Before I begin, I would like to issue a content warning. Today, I will be speaking about death and dying. If you are not in a place to hear about this, I suggest you sit this one out. Please take care. In 2010, I found myself living in a somewhat unique situation. I was living in a household with 4 generations under one roof. I lived there with my infant son, my parents, my 3 sisters, one whom was married with a small daughter, and my 86-year-old grandmother. A few years earlier, my grandfather had died, and at that time, my aging, though very active grandmother came to live with my family. We were a boisterous bunch of people trying to navigate a small space and trying to communicate effectively in a complicated hierarchy. My grandmother would sit back and watch and laugh as we tried to figure it out. As 2010 wore on, we noticed that my grandmother started becoming less active, more sleepy, and kind of just not herself. Eventually, she was diagnosed with late-stage liver cancer. After learning about her diagnosis and the possible outcomes of invasive treatments, she decided to forego that curative treatment and instead focus on spending the remaining days of her life with her family. Hello, my name is Suki Holly, and I have been volunteering with Whatcom Hospice for a little over a year. This summer, I will be a camp counselor at Camp Kaleidoscope, which is a grief camp for children ages 6 to 12. I'm also a member of the Bellingham Threshold Singers, which is a group of women who sing to dying people in their final days. Today I'm going to talk about a special type of end-of-life care called hospice. First, I'll share with you what hospice is and isn't, and who it is for. Then, I'll tell you about the dedicated team of caregivers who are involved in hospice care. Lastly, I'll detail some of the ways that the hospice team supports families and the patients through the death and dying process. So you might be wondering, what exactly is hospice and who is it for? The general definition of hospice is that it's a specialized type of healthcare that are for those who are facing a terminal illness, less than 6 months to live. It's also for people who are just dying of old age. And this care seeks to relieve pain and suffering. Symptom relief during hospice care is often referred to as palliative care. Hospice care is specifically focused on caring and not curing anything. In an article from the British medical journal Access July 2023 about Dame Cicely Saunders, who is the modern founder of hospice as we know it today, says that she introduced the idea of a patient's total pain. That includes things like physical pain, obviously, but also their emotional, social, and spiritual distress. Hospice seeks to alleviate all of these things. Some people have the view that when you decide to go on hospice care, you're giving up hope. However, as noted in an article from caringinfo.org, Access July 2023, hospice is in many ways the opposite of giving up. Instead, it gives a dying person autonomy and the ability to take control of what can otherwise seem like a very uncontrollable situation. Page 3 of the Peace Health Volunteer Handbook states that the hospice program is concerned with symptom management that maximizes patient comfort, enhances feelings of self-worth and well-being, and encourages patient participation in decisions that affect their living and their dying. The Volunteer Handbook goes on to state that hospice affirms life. It neither prolongs nor hastens death. One misunderstanding that people sometimes have about hospice care is that patients receive lethal doses of pain medication, but this could not be further from the truth. In the last section of this speech, I'll give a couple more details about how the care team manages pain and symptoms, but for now, rest assured that pain medication is highly monitored and controlled. Back in 2010, when my grandmother received the news that she had less than 6 months to live, she decided, with the care and guidance of her support people, her doctors, and her family, that hospice care was the best choice to help her manage her symptoms and to enjoy the remainder of her life. So now that you know what hospice care is and who it is for, let's talk about that dedicated people who carry out this amazing end-of-life care, the interdisciplinary team, also referred to as the IDT. Hospice care is best provided through a team approach, and at the center of that care is obviously the patient. The needs of the patient are the most important thing, and they include things like pain management and symptom control, but also a patient's mental health needs, their spiritual needs, and just practical body matters. The patient's loved ones are also incredibly important to the team. Family members are frequently the primary caregivers for a dying person when they're dying in their home. And so this can be incredibly taxing on those primary caregivers. The patients and the family members get to decide where hospice care happens. According to the Washington State Hospice and Palliative Care Organization's frequently asked question page, accessed July 2023, hospice care is a philosophy and not a place. So therefore, it can happen wherever a patient calls home. This can be the person's actual home, but it could also be a nursing home or a dedicated hospice facility such as Whatcom Hospice House. The National Hospice and Palliative Care website, accessed July 2023, states that the IDT is made up of the following: hospice care physicians and medical directors who come up with the plan of care, registered nurses, or RNs, who are available 24 hours a day to help manage pain and other symptoms. You also have medical social workers who assess how patients and family are coping with this process. And they also help facilitate legal and financial matters. Then there are CNAs, certified nursing assistants, who provide personal care such as feeding, bathing, and grooming. Then you have chaplains, who tend to the spiritual needs of the patients. This can often be one of the most important pieces of hospice care, even if a person isn't religious. And I'll talk a little bit about it in the next section. There's also volunteers, who are companions to the dying person, and they can provide respite care for those primary caregivers. Finally, there's bereavement professionals who assist the patient's family after their loved one has passed on. All of these team members are instrumental in meeting the special needs of dying and their families. And the IDT was a fount of resources for my family during my grandmother's last months and days. Now that you know who the hospice team is, let's get into a little more detail about what exactly they do and how they support the patients and families. In the previous section, I mentioned the importance of chaplains or spiritual support people. When a person is dying, they may have new or different spiritual needs than they ever did before. A Marie Curie website article, accessed July 2023, talks about how patients on hospice grapple with questions of life's meaning. They are questioning what life is all about, if there's an afterlife, what happens after death, and many other questions. And a spiritual counselor can help the dying person answer these for themselves and help them get a little bit of inner peace. Volunteers can also serve in a similar way because they are there to listen. Being a companion to someone who is dying gives that person an opportunity to share feelings that they might not have anywhere else to share. Patients sometimes feel like they have to keep it together in front of their family members, so volunteers can help them let their guard down a little bit. They can also help family members and primary caregivers get a little bit of a break from that caring. Volunteers can be present with the patient while the primary caregiver takes a nap or takes a shower or hangs out with friends. Anything that they need, really. So if you recall, in the first section, I mentioned a myth about lethal doses of pain medication. Physicians and RNs are the professionals who handle pain medications, and they're extremely skilled at what they do. In an April 2022 article from Integris Health, it describes how doctors and nurses carefully balance their patients' symptom control and quality of life. They're required to be up to date with the latest medications and how to use them. Medications like morphine can initially make a patient sleepy, but this is often because pain makes it hard for a person to fall asleep. And once their pain is under control, they're able to relax and get that much needed rest. It should also be noted that not all disease progression or old age comes with pain. So many times, pain medication isn't actually needed. The final piece I'd like to touch on is bereavement professionals who serve supporting the family members in their grief support. This can take many forms, including grief support groups, weekly or monthly check-ins that hospice provides up to 13 months after a loved one passes, memory keepsake workshops, and grief camps for children, like what I will be attending this summer. All of these help those left behind cope with their loss in healthy ways. And they emphasize that grief has no timeline and no order, and that we all do grief slightly differently. As you can see, the IDT is the backbone of quality hospice care. So in summation, today I've talked about what hospice care is and who it is for, how it utilizes an interdisciplinary team approach, and finally, how that team supports patients and families through the death and dying process. In 2011, around 6 months after receiving hospice care my grandmother died peacefully and without pain in my family home, surrounded by the people who loved her. I feel that this quote from Dame Cicely Saunders sums up the goal of hospice care nicely. You matter because you are you. You matter to the last moment of your life, and we will do all that we can to not only help you to die peacefully, but to also live until you die. Thank you.